the loose alveolar connective tissue, the bone tissue, myxomatous tissue, the blood vessels, lymphatic vessels and blood capillaries, hemangiomas and lymphangiomas, and the bony overgrowths, palatinus, torus, mandibularis, torus, palatinus, and multiple exostosis. So the next thing is the specialized connective tissue, in which we have both benign tumors and malignant tumors. I will be concentrating only on the benign counterparts, that is the benign tumors of muscle tissue origin and nerve tissue origin. Again, here in the muscle and nerve tissue also, those tumors which are quite common in the oral cavity or head and neck region, only those things I will be elaborating. Other things usually, I think you just have to know what they are. So coming to the muscle tissue origin, in muscle tissue origin, you have benign and malignant, both tumors, which can be both benign and malignant. In the benign category, you have leiomyoma, angiomyoma, rhabdomyoma, and granular cell myoblastoma. All these things are benign tumors of muscle tissue origin. Here, leiomyoma is a benign tumor of smooth muscle origin. Angiomyoma is also a benign tumor of smooth muscle origin related to the blood vessels. Similarly, rhabdomyoma is a benign tumor originating from the striated muscles. If you remember, you have two types of muscles, smooth muscle and striated muscles. So any benign tumor starting or originating from the smooth muscle is considered as leiomyoma. And any tumor arising from the striated muscle is considered as rhabdomyoma. And one more thing is granular cell myoblastoma. And the parallel counterparts of these benign tumors are the malignant counterparts. The counterpart of leiomyoma is leiomyosarcoma, rhabdomyosarcoma, angioma. Also, you can have this leiomyosarcoma or angiosarcoma, which comes under the other category, and alveolar soft part sarcoma. So these are the malignant counterparts of this benign muscle tissue origin. So in this, today I will be discussing about this leiomyoma, angiomyoma, and rhabdomyoma. Granular cell myoblastoma is, in exam point of view, is not so important, and there is some controversy whether this granular cell myoblastoma is a true muscle tissue origin or some consider it as a nerve tissue origin also. So the first one is leiomyoma. So I will be discussing about leiomyoma. So as I told you, leiomyoma is a benign tumor of smooth muscle origin. So wherever you have smooth muscles in the body, you can have this leiomyoma because it's a benign tumor. So wherever smooth muscles are there, you can have this leiomyoma. The most common location for this leiomyomas are uterus. In uterus, a lot of these fibroids are seen, especially in the female patients. You can see these fibroids which occur in the uterus, which is nothing but a soft tissue benign tumor originating from the smooth muscle. That is leiomyomas of the uterus. We call them as fibroids, which is the most common location. In oral cavity, usually these leiomyomas are very rare because smooth muscles are quite rare in the oral cavity, except in certain locations like the tongue, which is a common location for the leiomyomas in the oral cavity, if at all they occur, or blood vessels. Usually, blood vessel linings have the smooth muscle. So these are the places where you have smooth muscles. So leiomyomas can occur surrounding the blood vessels or smooth muscles present in the circumvallate papilla of the tongue. And based on how they appear, two types are mainly seen. One is solid leiomyomas, which are usually referred to as leiomyomas of soft tissue, deep soft tissue, or if they are associated with blood vessels, they are known as vascular leiomyomas. Vascular leiomyomas are leiomyomas originated from the smooth muscles of the blood vessels. And in such cases, they are also referred to as angiomyomas. Coming to the clinical features, majority of these cases occur in the posterior portion of the tongue because that is the common location where you can see the smooth muscles of the oral cavity, head and neck region. So most common location is the smooth muscle, posterior part of the tongue. Apart from that, you can see this